Minister Swan has been very clear that we still need to have considerable caution. Levels of COVID in the community remain really very high. The most reliable indicator is the population survey, which is conducted every week in Northern Ireland. The last numbers from that in the week up to the 5th of February suggested that around 1 in 13 of our population had COVID that week. That's around 20,000 cases a day. There is still a lot of COVID there. We all need to do our bit to continue to protect the most vulnerable, and wearing face coverings in appropriate settings is an important part of that. When something changes from regulation to guidance doesn't mean that our behaviours need to change, or indeed that they should change. I think most of our population are acutely aware of the dangers and risks which COVID has brought, the huge harms that have been done. We all want people to get back to living as normally as possible. Wearing a face covering in appropriate settings doesn't stop that. And it's helpful. It will reduce your risk of transmitting the virus to other people, and it will in some cases provide some small degree of protection to yourself as well. So we very much want people to continue to follow the guidance and to wear face coverings in appropriate settings. I think all of us look on today as a little bit of a milestone, certainly in terms of the removal of regulation. The 2 years have been incredibly difficult. They've been incredibly difficult for society, for the economy, for all of our colleagues who've been working in the health and social care system at the front line, and for patients and families, many of whom have made considerable sacrifices. I think we absolutely welcome the fact that ministers have decided to remove restrictions, but that does not mean that the epidemic is over. It's simply not. As I've said, the levels of infection remain really very high. People's behaviours need to remain cautious. We need to continue to meet outdoors, to use strong ventilation indoors where possible, to wear face coverings in settings where we can't keep our distance from other people, and to continue to use lateral flow and other tests, and to be careful in terms of our interactions with the most vulnerable. That hasn't changed for the moment. There may yet be more twists and turns. I hope not, but certainly today is something that we can all welcome and reflect on the sacrifices which have been made in the last 2 years. As I've said very carefully, I would absolutely not use the term Freedom Day. This is not Freedom Day. I hope this is a day when people will move from feeling that their behaviours are covered by regulation to using exactly the same behaviours through choice in response to guidance. That's what we all need to do, and continue to watch closely the numbers, the data, to take up opportunities for vaccination and to engage in other good behaviours. Things have not changed in that respect.